by Senator Edward Kennedy.
To Sir Edward Kennedy. That's the kind of greeting a knight deserves. It is thrilling to see you here, Teddy. We are so grateful for you taking the time to be here and the extraordinary work that your committee has already started to do, along with Mike Mack's office, Senator Ashley on the Senate side. Henry, I know that you guys are gearing to go on the House side. So I just want to, first of all, thank all of you for participating. Today was the first discussion in this effort, but it was not the last. In the coming days and weeks, we'll be convening a series of meetings with senior administration officials here at the White House to further explore some of the key issues that were raised today and to bring more voices into the conversation. But my understanding is that we had an extraordinarily productive set of sessions throughout the day. And I've gotten a readout from some of the breakout groups and breakout sessions. And I just want to summarize a few things that my staff thought were notable and that I thought were notable and are worth mentioning before I start taking some questions or some comments. First of all, a clear consensus that the need for health care reform is here and now. Senators Hatch, Enzi, Congressman Jim Cooper, and many others agreed that we can do health care reform. Senator Hatch said that we needed leadership on both sides, and he believes the Democrats and Republicans need to put politics aside and work together to do it. Senator Whitehouse said this isn't a Harry and Louise moment, it's a Thelma and Louise moment. We're in the car headed towards a cliff and we must act. Now, I just want to be clear, if you actually saw the movie, they did drive over the cliff. Just want to be clear, that's not our intention. Insurers agree. Scott Sirota with the Blue Cross Blue Shield Association said to consider past opposition the past. It is not the present. The time is right for action now. The American Medical Association said that they are here to be partners and to help. Tom Donahue with the Chamber of Commerce said that in the previous debate we knew where everyone stood. People are in different places now, including business, and that there's a vigorous understanding with all parties that improvements are needed. And Congressman Joe Barton complimented the process we've begun and said that he can agree with the principles that we've laid out. My staff thought that was a very notable statement. They're complimenting the process. Melody, I think, slipped that one in. With respect to the cost of care, Richard Kirsch with the Health Care for America Now said that we can't have a false dichotomy between coverage and costs. That by covering more people, we can also lower costs at the same time, presumably because those who are not insured at the moment are ending up using extraordinarily expensive emergency room care. Senator Whitehouse, you got two quotes in here. Senator Whitehouse pointed out that we pay more than $1 trillion. We pay more than $1 trillion more than other countries for the same or lower qualities of care. Ken Powell, CEO of General Mills and a member of the Business Roundtable, stressed the need to preserve the role of employers, and that many employers are investing in excellent prevention programs that are reducing costs and improving productivity. And I can testify to that. I've met a lot of extraordinary companies that have really taken the bull by the horns and are doing extraordinary work. Many participants stressed the need to invest in prevention, lower costs and improve care, to tackle obesity, manage chronic care, invest in comparative effectiveness. Congressman Dingell talked about the need to simplify the system to reduce costs and medical errors. Senators Baucus mentioned the need to make investments up front, such as health IT and comparative effectiveness, to get big savings, and that we have to align incentives towards quality. And Congressman Waxman suggested the same point that's been made earlier, that we can't control costs unless everyone is covered. With respect to the public plan, Congresswoman Jan Schakowsky and the AFL-CIO talked about the need to create a public option in order to reduce costs to consumers and save money within the system. There were others who raised some concerns about the impact of a public plan limiting choices. As for paying for reform, Congressman Rob Andrews challenged the group to identify additional ways to pay for reform and suggested that everyone needs to put something on the table to get reform done. And Senator Wyden raised the issue of modifying the tax exclusion for higher income Americans. Last set of points that we thought were notable, Senators Grassley and Hatch and Congressman Dingell all discussed the need to address medical malpractice and reduce defensive medicine as a cost-saving measure. So that's just some of the points that were made. I know that many of you had other insights. They have all been reported, and we are going to be generating a document coming out of this that summarizes much that was heard in these various breakout sessions. But what I want to do is just take some time now to give all of you a chance to hear from me directly. And I'm going to
gathering here today. You see the representatives of all the different groups that we have met with over the period of years. I mean, you have the insurance companies, you have the medical professions, all represented in one form or another. That has not been the case over the history of the past, going all the way back to Harry Truman's time. But it is the case now. And it is, I think, a tribute to your leadership in bringing all these people together, and really a leadership of so many that are gathered here today. Just in a very brief look around, and you can see representatives of so many of the different interests. It'd be hard to think of those interests being together and being as concerned and providing the leadership that they are, as they are demonstrating that kind of a commitment as we have today. What it does is basically challenges all of us to really do the best we can. And I know that you and all of your staff, I congratulate Max Balkus and my colleagues who have done such an extraordinary effort today. Just say that I'm looking forward to being a foot soldier in this undertaking, and this time we will not fail.